there. My name is Valeria Ferrari. Thank you for connecting here in this moment. I will do a short introduction of Dr. Lavorna. That is, for me, is a big pleasure tonight introducing him, and then I will immediately leave the word to him because it will be really a nice presentation, an interesting presentation, so I will not lose in time. So Dr. Lavorna graduated in dentistry and prosthodontics in 2005. He specialized in periodontology and prosthodontics and brought under the guidance of renewed expert in the field. As an active member of IOP, the Italian Academy of Prosthetic Dentistry, and of CDP, that is the Italian Society of Periodontology, and of course also of CEO, that is the Italian Society of Integrated Implantology. And also is a member of the EFP, that is the European Federation of Periodontology. He carries out an intense activity of consultancy in several dental practice. He's the founder and director of the Odonto Synergy, and it is a private practice in Telese Terme. So you can find the perfect combination of the manager of a private practice and also a doctor that is involved in different scientific society. When I think about Dr. Lavorna is one of our first key opinion leaders, is the digital dentist. When we think about the digital dentist, I think that we should think about Luca Lavorna. He's a master in combining different technology, always keeping an eye and getting focused in improving the treatment offered to the patient. So thank you, Luca. For me, it's a really big pleasure. I will kindly ask you if you have any questions to write them in the chat. There's the Q&A section. I will read at the end of the session, so we will not interrupt the Dr. Lavorna during the presentation. Thank you again, and let's see your master lesson.
Well, thank you very much. Thank you very much for the invitation, for the presentation, and thank you everything for staying here. And I hope to take your interest until the end of the presentation. So my name is Luca Lavorna, I live in Italy, and I am a periodontist, as Valeria described before. And I'm a special periodontist because I love the digital workflow. The Teethan guided dentistry is the core of my webinar, and the balance of stomatognetic system is the target of my daily clinical activity, from the simplest to the most complex case. Is now given scientific evidence that analyzing the stomatognetic system from a mere morphological angle is no longer satisfactory. Teethan allows the functional evaluation of the occlusal condition in a reliable and a repeatable way and quantifies the neuromuscular balance. And today I would like to show you my clinical approach with my patients, what I do every day in Odonto Synergy, my dental clinic. And I divide my clinical approach into 3 diagnostic moments: digital preview, neuromuscular analysis, and mock-up guided dentistry. We will talk in detail about each step through a multidisciplinary clinical case. This is the case. Here we have a very nice lady. The name is Agnese, which apparently shows no obvious problems, but her problems are different. She's 69 years old. She complains about masticatory discomfort, tension in the face, painful episodes with pain projection in the temporomandibular and auricular joint region. And the diagnosis, clinical diagnosis, is the collection of amnestic data, and the same semiological evaluation allows to formulate the diagnosis of craniomandibular dysfunction in a patient who has been showing untreated dental pathologies for some time. So a reorganization approach is envisaged. The clinical picture now appears clear upon observation of the radiographic examination. Her odontophobia had removed her from dental therapies for too long, until she reached the current clinical condition. The loss of the majority of dental elements and the evident mobility of the upper prosthetic manfact is the problem. This is the intraoral condition, lower processes, and without lower processes. The occlusal view. And then this is my first step, the digital preview. I want to show you with a short video for having showing the digital flow for having a correct digital smile project. The first thing you need is to have a professional equipment, a reflex camera, a tripod, and a macro lens. Then you need a calibration device such as glasses and the correct photographic protocol to have a ratio of 1:1. Then you can design the smile by choosing the best harmony in relation to the patient's lip and face. Finally, you can reproduce chairside everything you have designed thanks to a customized mockup, showing the patients a preview of the result, touching the therapy, hoping for a better day. So, come back to Agnese. This is the Digital Smile System project. That is a two-dimensional drawing, which will have an important clinical value due to the overlap with the intraoral scan. This is the scan of the upper arch and the lower one. So, okay. You can build the virtual patient starting from the patient's models and aligning the photographs with the aesthetic project. Using two calibrated photos from canine to canine, the alignment is very simple and fast. This is the old version of Hexacad, in which it was necessary to proceed with the superimposition manually, while now there's a digital tool that automatically matches the files. The important thing is that both are calibrated. You can adjust the two files and that's it. Right? It's an automatic process. It can be seen that in addition to the overlap, we are orienting the upper model with a reference plane. In other words, we are doing what we normally do with a Facebook, as shown in the slide, exactly like that. I therefore present the entire workflow that allows the patient's clinical data to be collected and to have a correct mockup on the first visit. Summarizing, we take two photos, the glass, scan the arts, create the smile design, transform it into 3D by CAD software, and with a 3D printer, we really make it. This is the new technology, very important for us. Returning to our clinical case, by this workflow, I realized the lower mockup, the upper one also. It's an indirect mockup that also contains the missing elements, the posterior ones, and as well-defined contact areas, as you can see in the canine premolars area, also for the lower arch. In this way, we can make the clinical evidence more real for the patient. Here is the mockup superimposed on the patient's arch, exactly on her bridge, also below the occlusal view. Here is the patient. Of course, we have to consider the increase in the final volumes due to the overlapping of the mockup. But this is a real experience for the patients, which we were able to achieve in a single appointment without touching anything. Well, now we are ready to talk about the second step, the most important, the neuromuscular analysis. A functional analysis, that is the evaluation of the system while in motion, must complement the morphological analysis. The functional analysis, therefore, plays a key role in facilitating the fulfillment of the therapeutical plan in total safety, searching for the balance of the system. We are talking about Teethan test. But what does balance mean? The state of the rest of the body. And we seek the balance of the neuromuscular system. I love to remember two sentences. One of Harry Seeker, a famous anatomist, that said, when bone and muscle fight, the muscles never lose. And another by Peter Dawson, when teeth and muscles fight, the muscles never lose. And so we cannot fail to consider the muscle activity when we approach prosthetic rehabilitations, especially complex ones. Teethan is the device that led us to analyze the system. What is it? Teethan is a surface electromyograph based on an exclusive technology, synchromyography. The system detects the parameters of dental occlusion by means of 4 probes applied near the anterior temporal muscles and the masseters of the patients. Teethan is the first totally wireless medical device capable of detecting the scientific parameters of dental occlusion in a simple, rapid, and non-invasive way. What is based on? Is based on the electromyographic investigation of the main masticatory muscles and records a biological signal that is the electrical activity generated by a muscle during contraction. I have to explain a little boring, a little boring question. Any dynamic action that affects the human body, such as locomotion, swallowing, chewing, is a predominantly automatic physiological function, which required in-depth studies. And the studies were conducted both on the biomechanical level and on the sensitive level. On the biomechanical level, the studies mainly adopt dental occlusion simulators, such as articulators, which evaluate the issue exclusively from a morphological point of view. But is not enough, because on the sensitive level, the question is very different, because the bony parts are not totally passive, the jaw does not move autonomously, and research has highlighted the richness of the projection of the masticatory system at the level of the central nervous system. So, I have to explain that the central nervous system processes the information recorded by the peripheral sensor receptor, modulates the activity of each muscle, and if a visual investigation is sufficient for a morphological analysis, it's not apply to a functional analysis. It's not enough. We need to quantify function. Let's analyze the system for a moment. Skeletal muscle is made up of motor units, and each motor unit is in turn constituted by the motor neuron, the axon, and the muscle fiber. Well, and the motor neuron, which is localized in the central nervous system, expresses its action on each fiber muscle through the neuromuscular junction and cause the contraction of motor units, generating a changing in potential. This results in the expression of an electrical signal which can be recorded by an electromyographic device. So we can register a signal of this electrical activity. And exactly the amplitude of the signal is recorded as a function of the intensity of the muscle force. This is a qualitative relationship, as if if it were an on-off switch, only a qualitative relationship. That is the problem. Teethan is different. Teethan is able to record the electrical activity of a muscle, to process the data, and to represent the biological phenomenon graphically. In other words, Teethan is able to establish a quantitative relationship. Several years ago, numerous studies confirmed that electromyography has now become a reliable and usable method in clinical practice, both in the diagnostic and the management of treatment plans in the various operation phases, just in the 80s. While more recently, Ferrario, who has produced many articles on the subject of electromyography, proved that Teethan analyzes the activity of the main masticatory muscles, the temporal and the masseter ones. So the relative load on each temporomandibular joint is not conditioned only by the clamping force, that is the clenching, but also by the ways in which this force is produced. So the targets are the temporal and masseter muscles. But what does it tell you? The Teethan therefore evaluates a quantitative analysis, unlike the previous devices. To this end, we need to introduce normalized indices, these ones. Among the proposed, the main ones are the activation, asymmetry, and torque indexes, and their definition is this. The indices derive from the ratio of the measurement of the average voltage calculated in a given time interval during the symmetrical contraction of homologous muscles. The most important for us, as I said, are the activation, asymmetry, and torque indexes. Subsequently, Ferrario also described the muscle symmetry indices, the muscle symmetry. And these indices are expressed by the degree of overlap of the activation curves of homologous muscles. And while the previous ones consider the average value of the measured voltage, they take into account the entire morphology of the electromyographic wave as a function of time, allowing to evaluate muscle symmetry during very short periods of time. So they constitute the natural completion of quantitative electromyographic analysis, and they are the percentage coefficient overlap, the impact, the center of gravity, and the torsion. This is the analysis screen of the many indices evaluated by Teethan, and the graphic processing very useful for an immediate interpretation. I would like to show you a quick video tutorial for showing how does Teethan work. So you have to connect the receiver to a USB, activate the probes by swiping them, and launch the software. Check the connection of the probes, enter the patient data, and apply the electrodes with the gel. Place the probes on the patients. The masseter. Okay. You can insert the salivary rollers and let tighten the rollers. Start calibration, repeat the step. If necessary, I prefer doing 2 times the calibration. Well, then you can remove the rollers and let make patient mouth closed and start the acquisition. That's it. Okay. It's very simple and fast, but the clinical value is so important. I will show you in the presentation. Well, the test is very simple, fast, and consists of 2 clenching tests lasting 5 seconds each. While traditional electromyography is influenced by skin conductivity, sweat, presence of skin fat, presence of air or skin air, and the position of electrodes, with the data normalization protocol of radio, Teethan's algorithm processes the differences and calculates how dental contact affects muscle activity. The final data is thus reliable, repeatable, and not affected by electrode placement and other factors. This is Teethan graphics where we can evaluate the indexes analyzed. Finally, you can have a report that has a medical legal value in which you can read the conclusion of the test. When I think of Teethan, I always think of my car's electronic stability control system. If we think about it, the ESC has 4 sensors, one for each wheel, which communicate their position and the forces acting on them at any time to the control unit. And the system check your trajectory. And the system corrects it where it detects a slip, acting on the wheels and excluding the driver's control of the steering wheel. With our patient, it's very similar, but we must have to consider a very important thing. Some researchers have demonstrated asymmetry in clench potential between left and right muscles, but Ferrario showed that healthy individuals have a prevalent side on which they generate higher levels of muscular activity during bilateral clenchings. Remember, healthy individuals. The conclusion is very important because the null hypothesis that the symmetry of electromyographic activity on muscular and anterior temporalis muscles is strictly connected with symmetry in occlusal contact, as measured by distribution of forces in relation to the maximum force exerted, was rejected. The null hypothesis was rejected. So the symmetry of electromyographic activity in asymptomatic young adult is not related to symmetry of occlusal contact. This conclusion is very important for us. So what do I mean? I mean that the navigator is able to simply point you in the right direction, but it's not a problem for the navigator if the driver chooses a wrong path. You are the drivers. The Teethan shows you the state of equilibrium or not of the neuromuscular system. It does not show you how to modify it or whether to modify it. You are the drivers. You have to control the system. Well, let's come back to our clinical case. So we did Teethan test with the MOCA. And as we can imagine, the patient's neuromuscular condition is greatly decompensated due to the instability of the upper prosthetic artifact and the incongruity of the occlusal planes. Let's observe the center of gravity completely displaced anteriorly due to the absence of the posterior elements. And let's observe the prevalence of the right chewing muscles, precisely where the instability of the superior bridge was most evident. So how can we proceed? At this point, we can introduce the third factor of our webinar, the mockup guided dentistry. We can transform our mockup into a bite to establish which therapeutic path we must undertake. Like that. Exactly. These are our therapeutic devices made of mild PMA. Teethan is really essential right now. We can already appreciate the difference with our mockup. We no longer have asymmetries. The contacts are balanced. The center of gravity obviously remains anterior. Remember then the mockups rest on the soft tissue at the rear. The posterior elements touch soft tissue. There we have no teeth. And the global muscle strength increases. See the impact factor. So look at the differences at the baseline. Very important difference in the balance of the neuromuscular analysis. But it's not enough. We must check the patient over time to confirm the correctness of the therapeutic choice. At 15 days, even the impact improves. This is normal thanks to the adaptation potential of the neuromuscular spindles. So the only parameters that we have to correct is the center of gravity, just in 15 days. But at 2 months, everything is stable. It remains only to check the position of the center of gravity, which, as already explained, is normal for it to be in an anterior position, okay? And the patient has a second class, a skeletal class. Then we approve the therapeutic project and get to the heart of the therapy. If the Teethan confirm the correct state of our neuromuscular system, okay, I can go on. If this was the starting point, now it will be the guiding thread of the whole workflow. Thanks to the principles of the mock-up guided dentistry, the third key point of our webinar, we can complete the diagnosis and we can establish the correct treatment plan. But for having it, we have to add another examination, the radiographic one. And thus, we can construct the virtual patient. The green device is a radiographic template needing to match all files, DICOM and STL ones. As you can see, there is everything you need. We can therefore carry out surgical treatment plan then considering all parameters that we have already tested in the previous 2 months. The primary request of the patient is to carry out the entire surgical treatment in a single step in order to reduce the emotional stress of the patients. And thanks to the superimposition, we can therefore perfectly plan our surgery respecting the correct prosthetic emergency. Also, for the lower arch, we have the matching of the lower arch. It's essential to develop a correct diagnosis and a consistent therapy from the first visit. In order to meet the needs of the patient, we planned an immediate simultaneous loading of both arches. And in a digital world, so the prosthetic design is not simply virtual, it's essential to respect a fundamental principle in prosthodontics, the cross mounting. That is the possibility of crossing all the working models without losing the occlusal parameters established at the baseline. That is the digital model in which the extraction were performed virtually. And this is the printed model of the approach, the identus model. This is the other model in which the implants have always been inserted virtually, the implant model. And we must assemble the models of both arches, maintaining the same intermaxillary relationship. But are we sure of this position? We must assemble the models of both arches in the same intermaxillary relationship, the same of before. From the starting point with the same relationship, We have to maintain that position. And thanks to a specific prototype as a transfer key, we can maintain the correct position of the models without changing their relationship, as shown in the slide. The prototype represents the duplicate of the initial mock-up, but which is able to fit perfectly to the edentulous models. The prototype is exactly the duplicate of that mock-up. And in this way, we respected the principles of cross-mounting, and believe me, if there were any wrong steps, we will never be able to cross the models as shown in this slide. So this is the cross-mounting, but is enough? Not. We have to cross all the working models from the initial one with the superimposed mockup to the edentulous one to the master model. These are all models mounted in articulator without increasing vertical dimension from time zero. If we have correctly mounted the models in the articulator, we can proceed with the realization of the temporary prosthetic restoration while maintaining the parameters already established with the mockup and approved by the Teethan. But we have a strange provisional. What is it? An anchored provisional. Computer-guided surgery is the only approach that allows for implants to be inserted with maximum control of the surgical project, respecting the established prosthetic position. In the same way, the provisional can be fixed at the end of the surgery using the same anchor pin used for implant surgery in order to ensure compliance with the same position already approved with the mockup. These are all prototypes of the full digital workflow, each useful for a specific working phase for both arches. These are the surgical templates fixed in the mouth for the upper arch and also for the lower. And here we have the implants in position. And here we can observe the provisionals anchored before gluing them to the temporary abutments. And the provisionals in situ after removing the anchors and suturing the flaps. The first check at 15 days for the upper arch and also for the lower. And post-operative condition at 2 months. 2 months, the first time that I unscrew the provisionals to check the state of the soft tissues. That is the radiographic control. And here we have the smile of the patient. And this is the comparison with the initial situation. And this is the check day, the day we start the prosthetic process, and in which, first of all, we confirm that our restoration are well tolerated by the neuromuscular system. So it's very important to perform the Teethan test. The Teethan test reports a perfect neuromuscular balance with the sum of the indices equal to 88. Oh, 88, the green circle, and a very good value. And with the slight anterior displacement of the center of gravity, always the same parameters, although the parameters is 89 and 76, that is a parameter so close to the normal that is 19. So I am very satisfied. Then we can proceed with the insertion of the scan bodies and take the intraoral scan. Here we have soft tissue stable at 4 months. And thanks to the functionalized provisionals, we can transfer the correct intermaxillary relationship using the same principles of cross-mounting, but in a digital key. We must always certify the correctness of the scan, and I do it through an aluminum bar, which we call test drive. And as you can see, in this case, it was necessary to separate both bars, the upper and the lower one. But it's not a problem. It's still possible to make up appointments and go further. I will show you how. I would also like to improve the lip support. How can I do both? Improve the lip support and check the correct position of the analog in the model. Always with a prototype, that is a mock-up superimposed to the test drive, and the test drive fits perfectly into this mock-up with the mock-up as a wax occlusal rim on the top. And you can see the test drive exactly inside the prototype. And in the mouth, you can put the acrylic resin inside the prototype. Place it on the bar, and you can have a perfect monoblock in which the bar is contained inside, and which allows you to create a new muscle model on which to finalize the prosthetic restoration. In the meantime, the occlusal rim is used to reestablish the level support and to reconfirm the correct occlusal plane, like that. Then I make a new smile design project, exactly like this, and the subsequent matching 2D, 3D files guarantees compliance with the initial design. Then I register the occlusal parameters and send all data to lab with the aim of reassembling the models like that. And finally, exactly as it's done in removable prosthodontics, it's possible to transform the wax rim into a new mock-up. But this mock-up is screwed on the mouth, on the implants. And you have to screw the mock-up for also confirm the correct position of the analogs. And the project, okay, this is always the same project, the single project that guided the entire therapeutic workflow. And you can test every stage of work thanks to special mockups. Then the cross-mounting protocol, always the same, and you can produce the framework. And the last prosthetic phase, such as the design of the framework and the ceramic layering, are completely guided by the morphology of the initial mockup. The only one mockup accepted in the first visit along with the patient. And finally, you can have the patient satisfaction, and this satisfaction is guaranteed because the patients always have an experience thanks to the mockup from the first visit to the last appointment, always with the same project. Also, you have to modify, as we perform in this case, a little bit the vertical dimension, but you can check that position thanks to the mockup and thanks to Teethan for confirming in each working phase exactly the state of the rest of the neuromuscular system. So this is the final restoration. You can see the restoration in the articulator, and the final restoration represents, therefore, the end of an operating cycle in which diagnosis and therapy fit perfectly, guaranteeing the clinician full operational safety and maximum patient satisfaction. Some details of the restoration: an intraoral view, the occlusal view, the harmony of the new smile, another perspective, and from time zero to provisionals until the new restoration, and the comparison with the baseline. Here we have the patient, the full harmony, the face, and the perfect correspondence with the virtual project, as you can see to your right. And the Teethan test confirms how, starting from the first moment in which we have verified a state of functional imbalance, the muscular system is in perfect harmony with the prosthetic restorations. And we cannot believe that the articulation map will be sufficient to have such a clinical confirmation. Okay, so the Teethan is the only device that lets you ask to the muscle system exactly the state of its balance. Okay, and it's so important before to have the next step of your operating workflow to ask to the neuromuscular system exactly the state of the balance, because you have to correct it if you have not. If you have imbalance, you have to correct it. And from the starting point of this clinical case, we have solved all the symptomatic problem of the patients, and then we followed that guidelines from first appointment to the last appointment. And every change of occlusion scheme, of function, every phase of my working time, I control and I check exactly with a special mockup exactly the condition of the muscle of the patient. So why Teethan? Why I suggest in each phase to use Teethan? Because it offers a new dimension of analysis to investigate and evaluate the patient's occlusal condition, because it allows you to integrate clinical experience with the quantitative data and the objective measurement, because it records data and information that make progress achieved over time comparable and documentable, because it improves clinical practice without changing the way you work. As the question of the articulating map, okay, always you can articulate your patient and control it by the articulating map. But in this way, you cannot controlling exactly the state of the balance of your neuromuscular system. Okay, with the articulating map, you can see exactly the contact areas of your patients. Okay, but you don't know exactly the state of the art. And remember the study that I mentioned. Okay, the study of Ferrari, the last one of 20 and 12, that also healthy individuals present an asymmetry in the contact areas. So it's not important to have a perfect well balanced symmetry in the contact area in your patient. You have to have a balance in your neuromuscular system. And the only way to have it is to check the state of your system. And in 5 seconds, you can check the system of your patient. So, why Teethan? Because it helps to communicate in a simple and visual way with the patient, and it improves dialogue with other therapists, like physiotherapists and postologists. It's so important, this aspect, nowadays. And Teethan give you additional protection in the event of legal medical disputes. And this aspect, I think that is so important also. A final Teethan represents a diagnostic revolution because it allows us to see what until now had remained hidden and only perceptible to palpation, but not quantifiable. Exactly as Galileo said many years earlier, measure what is measurable and make measurable what is not. So with this sentence, I would like to thank you for attention, and I would like to thank you for your time, and I hope that I can I can have stimulated your interest with this such a multidisciplinary case. But that is the time that we have to spend together, and after a very hard working day, I hope to, for me, I hope to um, stimulate your interest. Thank you very much for your time.